originally did this presentation for the Indiana Council on Problem Gambling. I do some contract work with them, and this is a 1.5 hour presentation that is online that you can access if you wanted to hear it there. So I'm going to pare some of this down, and we're going to go kind of quickly through the first few slides because I want us to be able to talk more about working with the clients and what happens with their trauma. And I'm going to move past the objectives. We hear that word trauma all the time. It's thrown around. We know what trauma is. We deal with clients with trauma. But just in case, we do have a few non-clinicians in the room. I want to just briefly say, what is trauma? It's a traumatic event in which one person experiences or witnesses or is confronted with actual or threatened death, serious injury, threat to physical integrity, or to self or another. Trauma can be lots of things to lots of people. Trauma is a pervasive problem. It results from exposure to an incident or series of events that are emotionally disturbing or life-threatening with lasting adverse effects on the individual's functioning, has to do with their mental, physical, social, emotional, or spiritual well-being. One of the traumas that happened in my life was in 2000 when the tornado hit Owensboro. Now, my friend in the back here, we lived on the same street. Her house was virtually totally destroyed. Mine was between a third and a half destroyed. And one of the things that made going through that trauma so much better, I think, for both of us, was we had each other as close friends to go through that trauma together. I was telling a group, I did a presentation for Webster County Drug Court the other day, and I was telling them that on that particular day that the tornado came through, I had been away from work it was maybe a week, the week between Christmas and New Year's. I had had bronchitis, so I had missed work. This was my first day back at work. And I still wasn't feeling 100%, and I thought, well, it's going to be cold as the day goes on. And I remember wearing a white sweater. And it was a fairly heavy sweater. And is it okay if I say who you are? Linda and I went to lunch that day. We went to O'Charlie's, and I remember being so hot in that sweater. And it had a really high neck with it. The tornado hit. We worked at Oasis in the spouse abuse shelter. We had 70 plus women and kids. We had to get safe. We knew our houses had been hit. I couldn't go home that night because as a supervisor, I stayed. They allowed her to go home, so she saw what was there. I stayed upstairs in one of the dorm rooms that the women stayed in, and I remember it getting cold that night. And the next day when I eventually did get home, we had snow flurries. So the temperature dropped from really hot to really cold. The next day I get home, I've still got that white sweater on. I get that white sweater off and put something else on. I could never wear that white sweater again. It seemed like that was something that I put my trauma in, was that one piece of clothing. To the point I was so glad when I decided to let go of some of the trauma and I got rid of the white sweater. But it symbolized so many things. At that exact same time, Linda's family and my family, we moved into the Executive Inn here in town, which is no more. She was able to secure a house and she got out rather quickly of living in the hotel. I was there a few more days, and the day we were supposed to leave the hotel, I caught my husband cheating. So I wrapped that trauma up in the same, not my current husband. No, he's not doing that. Need to clarify that one. So I wrapped up the trauma of that event all with the tornado. So when I say tornado, it's like accumulation of a lot of trauma that happened. It affected me mentally physically, socially, emotionally, and spiritually for a very long time. To this day, and I've had some EMDR done, which has helped, but to this day, when we get weather warnings, like that day in December when it got so bad here in Kentucky, those are hard days for me. And I don't breathe really well because my anxiety comes back. And I can even, to a certain degree, feel it as I'm standing here talking about that. But that is trauma. And our clients, be they substance abuse or gambling, and in most of, I look in this audience and I know where you guys work, they've got both. They're full of trauma. The long-lasting adverse effects of trauma on an individual result from the individual's experience of the event or their circumstance. Those effects can help them or cause a problem with their inabilities to cope with normal stresses. Normal stress for me, right after the tornado, was that spring when you start to get all the storm warnings where I would become almost paralyzed. I pace the floor. I'm looking out the window. I've got to see what's coming. I don't do those things anymore. Some days it gets a little hard to breathe, but I don't do all that anymore. So I wasn't able to cope with that normal stress. Trust and benefit from the relationships, because I remember driving home. When I caught him, I remember driving home and seeing her car in my driveway. And there were times, even though we moved from that house, my present husband and I, we moved, there were times when I would drive home and top the hill where we used to live. I haven't done it since we've moved. We moved last May. Would top the hill almost at my house. And in my mind, I could see that red car sitting there in the driveway. That's trauma. Some of these adverse effects will have to do with managing emotions, memory, attention, thinking, and behavior, and can lead to a constant state of arousal, eventually that constant state of arousal in your brain will eventually wear you down. And I'm going to talk about that, what it looks like when it wears you down, in just a little bit. What is trauma? It's the event, plus the way the event is experienced, plus the effect on the person. That equals their trauma. And I'm going to venture to say, because Linda and I are still very good friends, the trauma affected her much differently. And in ways she healed much quicker than I did. Because it affected her differently. And other people, if you were here and lived in that trauma that happened with that tornado, it affected you very differently. I was in a car wreck not this past New Year's Eve, but the New Year's Eve before. I have difficulty going past the intersection sometimes of where the car wreck was, and I was sitting still at the stop sign. I was a victim of the circumstances. Others of you may have, and I do pretty well with that trauma, others of you may have been in a car wreck, a much more serious car wreck, and you still have trauma associated with that. Now take that to the level of what our clients have to deal with. And most of your clients, I venture to say, are a lot like my clients, which are lower socioeconomic, compromised in many, many ways. They have bouts of homelessness and legal issues and poor relationships and limited support systems. They didn't have all those things around us that Linda and I had that made it much easier for us to cope with trauma. And I listen to some of their trauma stories and I say, wow, how fortunate I was. And what good coping skills I had and what support I had. Everyone experiences trauma. Levels of severity. You can experience trauma as a child, you can experience trauma as an adult. Towards the latter part of the discussion about trauma this morning, I'm going to show you some studies that were done on those living with disordered gambling and what kinds of trauma happened to them. Childhood trauma for them is just like it is for the childhood trauma for all those people we see in our offices every single day. Their traumas are more related to childhood than to adulthood. Responses to trauma are normal reactions to abnormal events. You have listed here several different kinds of traumas. Although trauma can occur at any age, it has particularly debilitating long-term effects on children's developing brains. Ongoing abuse and violence can induce feelings of shock, disbelief, confusion, terror, isolation, despair, loss of self-worth, and in turn can manifest as psychiatric symptoms or addiction. Over time, continued trauma may cause someone to develop PTSD to the point of overwhelming trauma that can persist for years. Trauma can be natural versus human. I mentioned 2 traumas I've had: natural, the tornado; human was the car accident. This can be things such as mine collapses, oil spills, train derailments, accidental gun shootings. It can be intentional human traumas, arsons, terrors, school violence. Most of you in here are from Owensboro. We've had 2 bomb threats in 2 days called into 2 different schools. That's going to cause some trauma in some of those developing brains of those adolescents. One thing I don't think gets enough attention is human trafficking. A child that's a runaway is most likely going to be trafficked within 48 hours of leaving. And Owensboro, sadly, has the most runaways that end up being human trafficked. Very sad, very sad. I sat on some trainings on human trafficking, and that's scary stuff. Individual trauma versus group trauma. Group trauma is like what's happening in the Ukraine right now. Individual trauma happens to a single person. It could be a single event, or it could be a prolonged type of trauma. It could be a single event like the tornado. It could be a prolonged type of trauma like child sexual abuse on a regular and routine basis. Those who have individual traumas are less likely to receive support. They are also less likely to reveal their traumas. And that is really key when you're talking about working with disordered gamblers. That's not going to easily be revealed. Persons who have individual trauma often feel responsible and isolated. They feel a violation of their trust of who their source of protection is. If you look at children, that very much happens. It also frequently reoccurs. And in homes where there's intimate partner violence, children are often the hidden casualty. I don't want to talk too long about ACEs because I think we've had plenty of training in that. But the ACE, Adverse Childhood Experiences, was developed in 1995 by Dr. Vincent Folletti and Dr. Robert Anda. They began to look at these adverse childhood experiences. They had a women's weight loss group. Well, Dr. Folletti did. And he was looking at them doing really, really well, and they got to a point where things were going well in their lives. They had lost weight. They were developing good coping skills. It's like, we're ready to discharge people because things are going so well. And what they found at that point in time is they started to sabotage. They started to fall backwards. They started to have poor outcomes. Things changed. And they were becoming physically ill with lots of other things. So he said, we need to research this some. So eventually they did the big study, and it's been replicated over and over. The initial study was 17,000 subjects, middle-aged, mostly like us in this room. They had diverse backgrounds, and they gave them the test, the 10-question test. I'm sure you've heard of that. If you haven't, you can Google it. Like I said, I don't want to spend a lot of time on it. 5 of the questions are personal. 5 have to do with living with family members who are experiencing lots of problems. And what they found was this was like a cholesterol score looking at childhood toxic stress. The person's ACE score, anywhere from 1 to 10, is the sum of the categories of the trauma that the child experienced. And we're looking at adults now. And so what they saw medically was an increase in all of these things that are listed here. The higher the score, the more likelihood that the person would suffer significant health problems in adulthood, health disease, chronic disease, heart disease, chronic lung disease, liver disease, increased rates of suicide, self-injurious behavior, adolescent health issues, teen pregnancy, sexual abuse, risk of re-victimization, smoking, alcohol, drug use, mental health, relationship instability, and workforce performance issues. I think the biggest one that I go to when I look at these increases in problems that are associated with the ACE scores. If you have an individual with an ACE score of 6 or more, the likelihood of them developing IV drug use goes up by 4,700%. That is astronomical. And from my perspective, and I think you guys would probably agree if you're seeing this population at all, more and more younger females are starting with a needle in their teenage years. And I'm seeing lots of, yeah, starting off with a drug use, then an older male that is grooming her for whatever is introducing her to a needle at 16, 17 years old. We could go on, and books have been written about ACE studies, but I just want to throw it out there. The other thing that before I leave the ACE studies, I want to put a plug in. Dr. Scott Hunt, who is one of our board members, and myself did a study over about a year's worth of time in 2018 and 19. And we were able to have interviewed a little over 100 women at the Davis County Detention Center. And some of you have heard us talk about this before. And the average ACE score of those women, we asked them questions about gambling, the ACE questions, domestic violence, sexual abuse. We had a pretty thorough questionnaire that we asked them. Their average ACE scores sitting in the detention center were like 7 point something. So huge amount of trauma that's happened. And they had a very high correlation between gambling or being partnered with a gambler and that high ACE score. Relationship between trauma and health risk. What we're talking about here is the development of coping mechanisms to alleviate emotional pain. And in this case, coping mechanisms are either addiction to substances or to addiction to process addictions, or as Dr. Barrett says, addictions without substance. Herein lies when we talk about gambling. Some of these coping strategies involve maladaptive behaviors, as we all see, unhealthy eating, tobacco use, alcohol, drug use, gambling. The long-term effects of toxic stress are well understood as we look at what happens in the brain when it gets flooded with toxic stress chemicals. What we see these individuals and what we label them as are the walking worried. And as they progress in their addiction to whatever, these walking worried go to walking unwell. And those individuals have to be seen by us and may even require hospitalization. What happens in the brain? The brain is just such a complex organ that we have in our body. It has 86 billion neurons, consumes 20% of the body's energy, 20% of the body's oxygen is used for the brain. New connections are formed every time you make a memory. The brain has tripled in size in the last 5 million years. The prefrontal cortex, which is all important, has grown in size by 6 times. Now, why am I bringing the brain in here? If you're going to do any kind of treatment with alcohol, drug, or gambling, or any of the other addictions without substance, you need to have some very basic brain chemistry, because this is where it's all involved. And that's all we're going to do today, is just a little bit. We had a neuroscientist here yesterday, and he would laugh and poo-poo away, I think, what I'm saying. But I want this to be very, very simple, because you need to teach your clients this. You need to teach your clients that this addiction is a brain disease. What happens first is the brainstem develops first. The second part is the limbic system, where you learn about attachment and emotional development. And the third is the cortical brain, towards the front of the brain, where you have thinking, caring, and you develop your inhibitions. The problem for traumatized children is that when they transition into a safe environment, the primitive brain does not turn off. That primitive brain is what's experiencing those traumas. Now, I'm talking about children, but it goes into adulthood. The child becomes developmentally stuck in their brainstem and in that midbrain area. Very little gets passed on to the higher regions of the brain. The higher regions of the brain cannot work properly if the lower regions of the brain don't work. In the first 1,000 days of life, brains are in a critical period of development. Trauma can negatively impact the areas of the brain responsible for cognitive functions, such as short-term memory and emotional regulation. This is due to how the body regulates stress. See, when you have this stress going on, your body, and we've all experienced this, your body will squirt out, that's my technical term, into your brain, adrenaline and cortisol. These are stress hormones. There's others, but these are the biggies. Exposure to these stress hormones plays an important role in keeping people safe. That's what teaches you to run, fight, flight, flee, flow, friend, whatever you need to do. You experience this kind of stress hormone being released over and over in your brain. You have poor childhood development, brain development, and adults who experience trauma in childhood are often wired differently. Their brains, our clients' brains, are primed to deal with the nearly constant stress. They struggle to respond appropriately to situations that to us would appear not normal and non-threatening. Can you think of some of those clients? I can. Think about those that we love to work with, those borderlines. How everything becomes a big deal. This partly explains why so many adult trauma survivors struggle with depression, anxiety, and other issues related to emotional regulations. And they often medicate with substances or addictive behaviors. I told you I was going to mention what happens when that brain, parts of the brain begin to wear away. If you think about it, if you have a shoelace on right now, at the end of the shoelace is that little plastic covering. It's called, I think it's called a capulet. Aglet. I knew it was something close to that. It's one of those weird trivia questions. That protects the end of your shoelace from fraying and then eventually unraveling, and you've got to go buy new shoelaces. On your DNA, you have something very similar to that, a protective coating called telomeres. Children under constant stress, these telomeres begin to wear away. Now, if you look in a classroom full of kids, if you teach, if you've been in a school classroom, if you look in a church classroom, a youth group, whatever, some of the kids are going to look older than the others, even though they're all the same age. That older look comes about because of those telomeres wearing away. And I asked my husband, because he's in a classroom every day, I said, do some of the kids in there look older than others? He said, well, yeah, some of them do. And he's in 7th grade. Literally, he's in 7th grade. And he said, why would that be? And I told him, and I said, those kids have probably been through a great deal of trauma. And as he's explored whoever these kids are, he's like, yeah, that makes a lot of sense. They are older looking. And we know from ACEs that you can have premature death 15 to 20 years earlier than your counterparts who don't have those high rates of ACEs. Also available in your brain are something called glial cells. These are the janitors in your brain. They clean out the toxic stress. And I just like to picture this little cell up there with a big push broom trying to sweep everything out of my brain. And it does a pretty good job of cleaning, but what happens is they get real zealous, these glial cells, and they clean out some of the good neurons in there that are needed, especially in later childhood and adolescence, for that developing brain. So then you get an adult who lost a lot of real important neurons when they were 11, 12, 13, 14 that they needed to have. Prefrontal cortex, call that the new brain. Down deep in your brain, in the midbrain, that's the old brain, caveman brain. Prefrontal cortex is the basic activity of orchestration of thoughts and actions, development of your internal goals. It determines, up here, determines good and bad and future consequences of your current activities. I'm told and asked so many times, why does this person do this addictive thing, whether it's meth or alcohol or gambling or shopping or whatever it is? Why do they do this addictive thing when they've got their children? They're going out and they're using meth, or they're spending all the money and there's no money left because, real money, gambling money, like Jody said, there's no money left to pay the bills. The kids are hungry. It's not that that mother or that dad does not love those children. It's that prefrontal cortex is not able to process that. And down deep in the brain, the substance or the process has hijacked the brain so that it becomes the most important thing in life. And I know you guys are nodding your head, yeah, you get it. They're not doing this stuff because I don't love my kids. I love my kids. But I love what I'm doing more at this point, because what happens is normally, in a normal brain, here exerts top-down influence over the midbrain. When addiction becomes present, that all goes haywire. Remember, all that impulse control gets stopped. So here's saying good, bad, right choices is not working. Down here says, do what feels good and do it again. That is in control of what's going on. The midbrain, the old brain, the caveman brain, this is the survival part of your brain. It starts to develop in utero at around 7 weeks. Many women may not even know that they're pregnant at 7 weeks. There's 4 real important things here. The hippocampus and the amygdala, those are tied up with memories and storage of memories. The ventral tegmental and the nucleus accumbens. This is known as the pleasure highway. In this part of the brain, as I alluded to just a minute ago, drugs work here. This part of your brain does not think, and it doesn't make choices, and it doesn't consider consequences. It acts in the next 10 seconds. And what it acts upon are things such as eat, defend, and kill. Think about caveman, had to go out and slay the beast. Bring it home, woman, here, cook the beast. Oh, woman cooked the beast, now let's reproduce. And the good Lord made all of this pleasurable. Along comes drugs that have developed over our history. Drugs supersede the eat, kill, defend, reproduce, hijack that brain to where drugs become more important. How many of you have heard your clients say, I used to live and I live to use? That's what's happened. Those drugs have taken over the midbrain. The hippocampus and the amygdala, you've got this in your handouts. The ventral tegmental and the nucleus accumbens, this is the neural pathway that delivers the pleasure. And pretty much we're talking mainly about dopamine here. This has to do with substances, the drugs of abuse, and it also has to do with the process addictions, such as gambling. The substance abuse or the process addictions become the most important thing to that addicted brain. It's very interesting, if we had time and we don't, to dig into what the hippocampus and the amygdala do as far as the storage of memories and the fight or flight response. I do want to mention the red alert that's in the capital letters here. Sometimes the amygdala, especially in these traumatized children, can become stuck. What happens when it becomes stuck? I'm used to whatever the trauma is that's happening at home, sexual abuse, physical abuse, watching mom get beat up by the boyfriend of the week, whatever the traumas are. So that little innocent things happen. Now think about a classroom. If my brain is on red alert all the time, and the teacher walks by me in that classroom, or a student walks by me and accidentally brushes up next to my shoulder or touches my foot, accidentally, those kids can go off. That's a kid who's stuck in that red alert with that trauma. Trauma takes that red alert to extreme. Fight, flight, freeze, flop, or friend. I added flop and friend. Those are my terms. Because sometimes, with Stockholm Syndrome, you have to friend whoever your abusing person is. The body remains on super high alert to the point of disassociating. That is a critical term when we talk about people who are sitting at slot machines often will disassociate. You are plugged up to that slot machine, and I've had so many women tell me this. It's like my new relationship. I become one with that machine. It tells me when I've done a good job. It tells me to have a good day. It tells me all kinds of nice things. It pays attention to me. And when I'm sitting there at that slot machine seat for 24, 36 hours, whatever it is, I'm in my own little world, and we've become one. Now it's time for me to get up and leave this place and go back to that dreary, awful, depressing, maybe violent, whatever environment that I'm trying to disassociate from. When you are dealing with trauma individuals, ask, what did you see? You need to pull their senses out. Ask, what did you see? What did you hear? What did you taste? What did you feel? Go back to the day the tornado hit us in 2000. What did I tell you? That sweater was so hot. And I felt like it was choking me with that high neck collar that it had. That was what I was feeling, what I was experiencing. What did I hear? What did I taste? Don't ask them what happened to you. They've been asked that lots and lots. Ask them, who did this? What were your feelings? Tell me about the experience. Real simple little definition of addiction. It's ritualized, comfort-seeking behaviors. Now go back to that lady, and I label it ladies, it doesn't have to be. Use a client I've had. Go back to the mid-60-year-old lady or woman that is sitting at the slot machine over in Owensboro at the venue. She doesn't want to go home because her husband never communicates with her. When he does, it's more like he was ex-military, he's barking orders to her. She's in trouble to the tune of about, she was mid-60s, maybe touching 70. She's in trouble to the tune of about $100,000 in debt. At 70, they're going to have to get rid of their home to pay off the debt. So everybody's angry with her. But if I sit at the slot machine and the slot machine's telling me nice things and praises me when I win something, and I forget what time it is because there's no clocks and there's no curtains and windows, and you don't know if it's day or night in that casino, I feel okay. It's like Cinderella. I know eventually I'm going to have to leave here, and it's going to be awful when I do have to leave here. But for right now, I'm at the ball, and it feels really good. Jody kind of mentioned this yesterday, and I want to put it in my words. Gambling is not about the money. Gambling is about using the money to stay in the action. The action of whatever the gambling that you're doing, that is the addiction. You are addicted to that action because that's what's releasing the dopamine in the brain. What are we looking at with addiction? Any dysfunctional or habitual form of coping with emotions. I like that. And I think if people would take that definition on, we would have a whole lot less stigma attached to what we do. Any dysfunctional and habitual form of coping with emotions. Addiction leaves the root problem unaddressed and the emotional needs unmet. In many cases, we treat the drug use, the gambling, the alcohol use. We don't get down and peel those layers well enough to get to the root of what's causing it. The coping with emotions. Life becomes organized around the addiction. We've already talked about trauma. If you haven't read Bessel van der Kolk's book, The Body Keeps Score, I encourage you to do that. This is a quote from his book. Being traumatized means continuing to organize your life as if the trauma were still going on, unchanged and immutable, as if every new encounter or event is contaminated by the past. You're not able to separate yourself from that. The executive functioning of the prefrontal cortex is offline. The top-down functioning doesn't work. I absolutely love the work done by Kevin McCauley. I know Dr. Barrett does as well. This is straight out of some of his work. If you get the opportunity, and I show it in every kind of group that I do, his video, it's about an hour long, Pleasure Unwoven, is absolutely the best, isn't it, Kurt? Absolutely.
One comment about it, though. It's still uses the term dopamine, and today we know that it ought to be saying the dopamines.
Different dopamines, yes.
And we have no idea what many of them are. It's kind of like Capella's intelligence. We know they're there, we have no idea how to measure it.
But again, I'm going to echo what Jody said. Macaulay's work is 2010. We don't have real good research out there. Jeremy, you need to do some research on gambling. You're the researcher in here. I think also when you're looking at the research, when you're looking at these clients, we have to consider the role of shame in their lives. And we have to consider what stage of change they're in. Look at Chaska and DiClementi's work for that. And I'm sure most of you are very familiar with that. Look at some of these research that has been done with treating trauma and treating the disordered gambler. People with disordered gambling tend to have a history of trauma at higher rates of intimate partner violence, child abuse, neglect, and other life events. If you have a gambler before you, you need to do some kind of trauma assessment. We do life events checklist. It's not the greatest. That's what's available for us to use. But you are missing core aspects of treatment if you don't explore their trauma. You're not going to give them the best care if you don't explore that trauma. Up to a third of people with disordered gambling have a diagnosis of PTSD. Women with gambling problems are more likely to have a personal history of trauma and mental health than the men. This was a study done in Canada, so they talk about Indigenous peoples in Canada. Women are also more likely to have partners who have mental health issues, SUD, and gambling, or who are unfaithful or absent. Another thing that gambling does, teaches you to escape. That's what they're doing sitting in the casino at the slot machine, disassociating. It relieves stress, it relieves loneliness and depression. All of these are connected with trauma. Here's another study out of Canada. Gamblers with a history of trauma are more likely to have more severe gambling problems, more severe mental health problems, substance abuse problems, family history of substance abuse problems, and impulse control issues. That shouldn't come as a surprise to anybody when you look at that. Gambling disorder and childhood trauma. This was done on a control group of 31 individuals and 31 adult patients who had gambling disorder. They were administered the childhood trauma questionnaire and the life event stress scale. Severity of childhood trauma was a significant predictor of diagnosis of gambling disorder. Childhood neglect was a single trauma subtype to significantly increase the odds of gambling disorder in adulthood. Childhood neglect. That can be physical neglect, it can be emotional neglect. We tend to think along the lines of physical or sexual, maybe even emotional abuse. I challenge you to think and add questions on neglect, because that's where they're identifying most of, a whole lot of their trauma was in the neglect. Stressful life events were significantly higher in gambling patients compared to the control group. Findings may suggest a link between childhood trauma and gambling disorder, with current stress as a moderating variable. Another study had 107 participants, 39 with gambling disorder, 20 with an internet addiction, 28 were IV heroin users in an MAT program, and 20 were there for a control group. They also used the childhood trauma questionnaire. High prevalence of childhood trauma in all three groups except for the control group. 74% had gambling disorder, 80% with internet addiction, and 93% in the opiate group had high rates of childhood trauma. Highest, again, emotional neglect. I love seeing Sharon going, yeah, this makes sense. This is a study done in the United Kingdom, Canada, New Zealand, Australia. All these places are way ahead of us with research. The United States lacks on research with gambling. This was over 3,000 men in the UK, 18 to 64, 7% were disordered gamblers, and 5% were at risk for gambling disorders. Gamblers are twice as likely to have witnessed violence or to have experienced physical abuse as a child. Twice as likely. 3 times just as likely to have suffered a serious or life-threatening injury to a child. Here we go. As an adult, they experience more violence in the home, had mortgages or relationships to fall apart, become homeless, lose jobs, have money issues, or be convicted of crimes. All of that goes hand in hand with what happens with gambling. Another study, this was out of Auckland University. 10% experienced physical assaults as kids. 25% of the disordered gamblers who place bets regardless of their mood or winning or losing status witnessed violence as kids. Go back to that ACE study. We're talking neglect and we're talking what's happening in that dysfunctional home more than really the childhood abuses. Individuals with a history of child adversity appear more likely than those without such history to repeat subsequent disordered gambling as adolescents and adults. This was another study. Child abuse increased the risk of disordered gambling by 131%. Child neglect increases the risk of disordered gambling by 453%. Witnessing violence by 183%. A physical attack increases it by 230%. At-risk disordered gamblers are 620% more likely to develop PTSD. Intimate partner violence, this has been a very big interest of mine for years. Among gamblers, 25% reported engaging in spouse abuse. This is why when Jody's talking about real money and gambling money, and you go to GA and you talk about who's going to be in control of the money, and you as a therapist working with him and you're trying to get some of that money stuff straightened out, you've got to be very, very careful and plan for safety before you give somebody the okay to be in charge of their money. Jeremy.
Has there been any research on racial trauma and addiction?
I have not seen it. Sharon, you're kind of saying yes.
Like, not with the racial trauma, and yes. It's there, but I couldn't speak to it.
Gambling research is hard to come by. And I'm going to go back to that one again. It's just not enough out there. Children of gamblers are 2 to 3 times more likely to be abused by a parent. A veteran study, 8 to 10% of veterans using VA treatment could have a diagnosis of disordered gambling. 13% of those seeking gambling treatment have co-occurring PTSD. Need for post-deployment gambling screening at the time of their health screenings. When these individuals, these young men and women come back to the United States, we need to see what they've been doing, because gambling has become a large coping skill for veterans. Kind of summing up the research, and I've got a few minutes left. Individuals with a gambling disorder report higher levels of lifetime history of PTSD. Individuals with a gambling disorder or PTSD are at greater risk of developing the other. Individuals with childhood trauma are at greater risk for developing gambling disorders later in life. There's a greater use of gambling to cope with negative emotions. Intimate partner violence is very much related to gambling, and childhood neglect is very much related to gambling. I'm going to talk just for a minute, because we've been asked over and over when we plan these conferences to talk about treatment when you're working with that gambler. So I want to end today talking a little bit about treatment. Do not rush into treating that trauma. You treat trauma when it appears. Let them be the one to bring that up. Know what you are talking about. If you're not skilled in gambling, the gambling lingo, the whole thing about surrounding gambling, then you get them to somebody that does understand gambling. Build the relationship first with the client before you get involved in trauma. Build and provide safety into your sessions. If you get the opportunity to be trained in seeking safety, I highly encourage you to do that. Explore possibilities of harm reduction. That kind of rubs this old abstinence girl a little bit wrong, because I do like abstinence, but I've had to use harm reduction before, not just super successfully, but had to use it before. Teach coping skills. Sometimes medication management and antidepressants sometimes is helpful. Do a thorough assessment. Remember that the gambling activity, just like substance abuse, numbs, it fights the memories, it self-soothes, and it eases the depression. But there's a need to keep increasing whatever that addictive behavior is to keep away the effects of the trauma until the using of gambling or substances becomes a greater problem than what the activity is trying to cover up. You need to teach your clients, and I think this is a really good statement, that sobriety from whatever their substance is and safety are the same things. Help the client to learn that the interaction between trauma and addiction is work. And teach them resiliency. Relapse prevention, plan as if relapse will happen, because in many instances it does. Watch for the red flags, explore the triggers, teach them recovery capital, coping skills, create for them, with them, a lifestyle centered around recovery. Borrow from other things you've learned with other addiction work. Look towards decreasing the trauma symptoms. Remember, halt. Don't get too hungry, angry, lonely, and tired. One day at a time, and first things first. There's a real reason that substance use uses those catchy little phrases, because they work. Some good treatment approaches when working with trauma, motivational interviewing, like what George talked about yesterday, CBT, EMDR, mindfulness, GA. I want to put a plug in for SMART recovery. If you're not trained in, familiar with SMART recovery, get familiar with it. When Jody was talking about, I've had other people in here texting me during this, I feel old. When Jody's talking about all that technical stuff, I feel old too. But that group of young people is going to respond probably in good amounts, good numbers, to SMART recovery. SMART recovery is self-management and recovery techniques. It's based on CBT. They do away with all the spirituality that you get in a GA meeting or an AA or an NA. They do a lot of homework, a lot of cognitive CBT stuff. They give you what we call pros and cons list. You get into there. Somebody remember what they call that? It's a special name on that. My mind's going blank. But they do some really, really cool stuff. We do have a SMART recovery group here in town for those that are local. And I think we need to get some more started. It's about 25 hours of online training, and it's about $350 to go through the training, but it's good. Stress reduction is also very good. In conclusion, and bringing it all forward, because I think this is what I most want you to remember. It's important to know some of that brain stuff. It's important to know about ACEs, but this is the key to what you need to know. Our job as clinicians is to help others' brains change. the therapeutic relationship that they have with you can change and develop new neurons in their brains in as little as 2 minutes. Unconditional positive love, I didn't use regard, I said love, from the therapist to the patient can change genetic expression. Always have a smile and a positive attitude because clients read our expressions. Before we know it, they're reading our expressions in a split second. I know I had a lady that I treated for a long time that, you know, in the DSM, her picture's next to borderline personality disorder. I would go to the front of the clinic, and I didn't even call her name out because I was trying to be, you know, HIPAA mindful. She'd see me and she thought it was me. I would go and I'd peep around the corner so she'd see me. By the time she got up out of her chair, and I'm still standing, you know, behind the door, she walks around the doorway to me and she says, "What's wrong? Are you not feeling good? Does your knee hurt today? Something happened." I haven't even said hello to her. And she's looked at the expressions on me, which aren't accurate ever, and she's saying, "What's wrong with you?" Mood and intentions of clinicians can change outcomes in people's brains. Remember your own self-care and honor your personal traumas, whatever they be. This is a quote that I read, and this is what we do. And this is from a guy that went through therapy. And he said, "It took many years of vomiting up all the filth I'd been taught about myself and half believed before I was able to walk on earth as though I had a right to be here." Be that therapist that they need. Gloria?
I was just gonna relate what you were saying about them paying attention to our moods back to what you were saying about their neglect. That's a survival skill that comes from that neglect because they've had to watch people's moods so much that they've related that survival skill. They check our mood every 10 seconds.
Yes.
That's a survival skill that they may never change.
Absolutely.
So we have to make sure that our face matches what we're doing, because they're gonna be checking us all the time.
Absolutely. Be very aware of what your body language is saying. I thank you for your time.
RonSonLyn?